I am Dr. Rajesh Gadia, a consultant physician at the KM Hospital, Pune. Today, I am going to talk on coronavirus. Just everybody is doing the same, but let us make it a little different. I will be talking on three aspects of the coronavirus. One is the historical background and what are the modes of transmission. In the second video, I will talk on what are the clinical features of this virus and how do we prevent this virus from rapidly progressing. Today, let us discuss the historical background and the modes of transmission of the coronavirus. Coronavirus has been detected a few decades ago. It was not so that it will just come out of the blue suddenly yesterday. One of the strains of coronavirus is Covid-19. So coronavirus is there for the last few decades, but came into clinical presentations only in the last 20 years. Why is it called corona? First, you have to understand why corona, the name came out. Now, if you realize the coronavirus is a structure like this, around, and then it has small outpouchings of proteinaceous outgrowths like this on the surface. These outgrowths, when you look at it, it looks like a crown. And crown in Latin is called as corona, hence it is called as coronavirus. When did the first outbreak? There are around 7 human strains which are known that produce symptomatic disease in a corona in humans. Now understand that corona is a zoonotic disease. It is found in animals, and from the animals it came into humans. What we realized this time was there are seven different types of coronavirus. And one of the strains like OC43 and HK01 is around in the community for quite some time. For the last 2 years we are seeing cases of the same. They produce a mild respiratory illness. Then we had a major outbreak of severe or SARS Corona 1 that was in 2003, and that is also called as severe acute respiratory syndrome. After that we had a H1N1 outbreak in 2008, and then in 2012 we had MERS. MERS is also called as Middle Eastern Respiratory Syndrome. That was in 2012. Now in December 19 we got an epidemic of coronavirus. SARS-2 or SARS-2 coronavirus, or also known as COVID-19 as we call it. It progressed so rapidly that the WHO, this started from a city by the name of Wuhan in China, where they found that some of these, quite a few of these patients has visited that market. And when they went to the seafood market, they got corona disease. What happened thereafter was for everybody to see in the last, which it spread so rapidly, it went an epidemic, and then WHO in the early March declared this as a pandemic. What does this coronavirus do and what are the symptoms? I'll speak in the next talk. But then, how does the coronavirus transmit? How does it go from person to person? The two most important modes of transmission which you should all know, and which, if you know those modes of transmission, you'll be able to prevent the disease. The first mode of transmission is droplet transmission. In the droplet transmission, the coronavirus is transmitted when the patient coughs. Now, if you cough, you transmit 3,000 droplets at one time, up to 3,000 droplets. Now, these droplets remain in the air for 3 to 4 hours. And sometimes it can remain in the air for even a smaller part, can remain in the for the next few hours. Now, imagine I have coughed in this room and I have gone, and someone else enters this room and the droplets are in the air, then he can get the virus if he is not worn a mask. That's the reason it is so important that droplet transmission has to be prevented by wearing masks. These droplets can go onto the surfaces also. They can go on the surface, which I will discuss now, and that is known in the second. And when they are on the surface, you can touch the surface and get the infection. Now, how far does the droplet go? The WHO say that it will keep 2 meters apart. So around 5 to 6 feet apart when you are next to a symptomatic patient. Means that I have got the symptoms of fever and cough, and I should be maintaining a distance of 6 feet from anybody else. So please maintain a distance of 4 to 6 feet from anybody who is symptomatic. So when does this patient transmit the virus? So when is he most contagious? Now there was the issue that even before the person gets fever or cough, people were discussing that he can transmit the virus. That is pretty rare. The main mode of transmission is when the patient is not symptomatic, is symptomatic, means he's got fever, he's cough, he's got breathlessness, he can transmit the virus. In the incubation period, the transmission of virus is quite rare, where he's asymptomatic. Now the second most important mode of transmission is surface to body transmission. Means I have a surface, I cough out the droplets goes on to I am suppose sitting over here and the droplets goes on the frame and I touch this frame. After I touch this frame, and if I touch my eyes or my face like this, I can transmit the virus. As simple as that. So that's what came in, that the first mode of transmission, I said keep a distance of 4 to 6 feet or 3 feet minimum. And the WHO says 4 feet should be minimum. We say the second mode of transmission, I always say that do not touch your face. Do not touch your face. You wear a mask so that droplets don't come in. And any surface you touch, before you touch the surface, you put alcohol rub or you wash your hands. So wash your hands with soap and water for 20 seconds, or you put the alcohol rub on your hand, rub your hand, and then only you should touch your face. So do not touch your face after touching any surface, whether it's glass, whether it's wood, whether it is steel. So do not touch the surface. So these are the two most important methods of transmission of a coronavirus, which you should be aware of. So first we discussed the historical background, the second is the mode of transmission. Now we should know on which surfaces that the coronavirus lasts, for how long. This is most important because earlier you remember H1N1 is only by droplet transmission, that if you cough you get it and the virus dies. But if you don't, in coronavirus lasts for some hours on certain surfaces. So this became the most worrisome thing in corona. Now, as I told you, a droplet in the air will last for 3 to 6 hours. So that's why wearing a mask is important, because you wouldn't know which environment you are going in. You go into that environment, somebody's coughed over there, you can get the virus. So you please see that you are wearing a mask at most of the times where you are in a suspected environment like a hospital, or there is somebody who is coughing next to you. So please wear a mask. 2. Any surfaces like cardboard surfaces, you get a carton, you order something on the internet and they post it in the carton box. Now that can have a coronavirus. So the cardboard surface, the coronavirus can last for 24 hours. Any cardboard or paper surfaces. Second, how does the coronavirus last on glass and plastic and steel? It lasts for 48 to 72 hours and up to 9 days sometimes. This is very, very worrisome, because you can have a table at home and somebody's coughed over there, he's gone away, and you come later, you touch the surface and then you touch your face. Finish. That's how the coronavirus comes in. So your most important concept should be that yes, that the surface has to be clean. Or if you can't clean the surface again and again, it might as well wash your hands or put alcohol rub before you touch the face. So as I said, the coronavirus can last in air for 3 to 6 hours, cardboard surfaces for 24 hours, glass, steel and metal or plastics for around 48 to 72 hours. So you have to be careful on which surface. Copper is the smallest. So on copper it lasts for not even 4 hours. So that is the smallest number of time that a coronavirus can last on. So you should be careful on which surface. That means in the prevention we'll let you know that you clean the surfaces regularly with alcohol rubs. So that's the best way to clean the surfaces. For today, I'll be discussing on this video, I'll be discussing on these three. I've just told you about these 3 things. One, I told you about the transmission. One, I told you about the modes of transmission. And third, I've told you on which surface how it can last. And please hold up to my second video in which I'll discuss the clinical features of the coronavirus. Thank you.